This presentation is about using hallucinogenic drugs to treat mental illnesses and addictions. Over 21 million Americans suffer from addiction, and 1 in 5 Americans have been diagnosed with a mental illness. Treatments for addiction and mental illnesses are commonly psychotherapy, rehab, and medications such as Sublocade, methadone, and SSRIs. While these treatments may work for some, they do not work for everyone. What are hallucinogenic drugs? The most popular are ketamine, psilocybin, LSD, and peyote. These drugs cause psychedelic trips, which involve hallucinations, tasting shapes and colors, and an altered state of mind. They are classified as Schedule I drugs and are illegal to use, manufacture, and distribute. A short historical background on psychedelics, more specifically LSD, is that LSD was invented by a scientist named Albert Hofmann who did not know about its hallucinogenic effects until accidentally ingesting some years later. LSD has been used by the CIA for mind control and to obtain information, like an MK Ultra. The downside of LSD is that most LSD that is bought off the street markets have a higher chance of being laced with harmful substances. LSD is usually not the first choice when it comes to being used as treatment, but it has shown evidence of being effective. Some research involving LSD includes a study done in Switzerland involving 60 individuals diagnosed with depression over the age of 25 who had no experience with psychedelics. The first group was given 13 nanograms of LSD and the second group was given 26 nanograms of LSD, and the control group was given a placebo. Over the course of a few weeks, the placebo group reported little change, while both groups that were given LSD reported that there were changes to their sleep patterns, had lower levels of depression and anxiety, and had lower pain levels. This graph shows the results of the previous study. The group that was given 13 nanograms of LSD showed the most effective results with a VOS rating of 0, meaning no pain. The results of the study were that 13 nanograms of LSD is the optimal dosage of LSD to treat illness, or specifically in this case, depression. Ketamine has also been used and studied as a treatment for depression and has been effective in alleviating symptoms. There are currently 2 different types of ketamine being used as treatment. Racemate ketamine is usually given as an infusion into the bloodstream, and S-ketamine is given as a nasal spray. Ketamine works by targeting NMDA receptors and may reduce signals that are involved in inflammation, which have been correlated with mood disorders. A study done using ketamine was conducted in India. 25 drug-free males who all had no history of psychotic disorders or previous experience with psychedelics were injected with ketamine over the course of 2 weeks and reported improvement in depression and anxiety. Ketamine is now being offered as treatment for depression at certain clinics. Psilocybin is the most commonly researched hallucinogenic drug. Psilocybin are a group of fungi that convert into psilocin when ingested. Researchers from Johns Hopkins University were the first to gain regulatory approval to research psilocybin. A study was done by gathering a group of cigarette smokers who have no success in quitting smoking and treating them with various doses of psilocybin. It was found that the abstinence rate after 6 months for the participants of the study was 80%, which is way higher than the usual success rates in other trials used to quit smoking. Within the same study, they found that psilocybin helped patients with depression, anxiety, alcoholism, and OCD. This chart shows the results from the previous study, where participants were given 20 to 30 milligrams of psilocybin and found that the drug helped them stop smoking. The results on other psychiatric conditions also show positive results, such as improvement in participants with depression, anxiety, alcoholism, and OCD. The outcomes of the study also revealed that treatments were not dose-dependent. As stated before, psilocybin is the most commonly used psychedelic to treat illnesses. Psilocybin has the most favorable safety profile, meaning it is less likely to cause harm to both the user and the people around the user. Psilocybin is also a low-abuse drug and is physically non-addictive. As you can see in this graph, the gray squares, psilocybin, are the most used and studied psychedelics starting from 2012. This figure shows a chart displaying various types of substances that are commonly used and often abused. The blue represents the harm done to the substance user, and the red represents the harm done to others surrounding the user. On the far left, alcohol is shown to be the substance that caused the most harm done to both the user and the people around them. However, on the far right, it shows that psilocybin and LSD cause the least harm to both the user and others. The chemical structures of psilocybin, DMT, and LSD are all relatively similar looking to the neurotransmitter serotonin. Serotonin is responsible for controlling your mood and happiness, and the similarity in their structures allows them to stimulate neurons in the brain that are sensitive to serotonin, which leads to depression and other illnesses being alleviated. Psychedelic effects are assumed to start through stimulating serotonin 2A receptors by psilocin. Various types of hallucinogenic drugs have been and are also being researched as a method for treatment for depression, PTSD, addiction, and other mental disorders. The most effective and natural of these hallucinogenic drugs are psilocybin because it is a fungus and is the most effective as it causes the least long-term side effects. Hallucinogens have also been promising treatments for mental illnesses and addiction, and the legalization of them being able to be used in scientific studies shows an optimistic future of them being offered as viable treatments. Some ethical issues that may arise from this form of therapy are patients with a family history of psychotic disorders and schizophrenia showing adverse reactions. It is important for doctors and medical professionals to assess the patient's medical history before continuing with such treatment, as it is a cause for concern for many people. Despite hallucinogens having a negative connotation in society due to them being labeled a Schedule I substance, they have shown promising improvements for people who are struggling with such issues.